plastic surgeon in private practice in Beverly Hills. For most of my early life, my background is very, very academic. I went to Harvard, I majored in molecular and cellular biology. I've done a lot of scientific research, and I actually was here at UCLA for many, many years. I went here for 4 years of medical school, and then I did 2 surgery residencies, which totaled 8 years of surgical training. So if you imagine that, I was here for 12 years. So plastic surgery is a very broad field. A lot of people don't realize it, but it encompasses congenital defects, it encompasses trauma, reconstruction. When I was at UCLA, I mostly did a lot of breast cancer reconstruction, a lot of trauma, things like that. Now in private practice, I mostly do pretty much 100% cosmetic surgery. So tummy tucks, liposuction, a lot of breast surgery, and I know that in high school, social media is huge. It's also a big part of my practice. I use it as an educational tool to show people what it's like to be a plastic surgeon, to show people what the surgeries are like, what the practice is like. So if you want to know more about me, my Instagram is Beauty by Dr. Cat. My Snapchat is Beauty by Dr. Cat. I also have a lot of educational videos on YouTube. And you can actually see live surgeries, everything else about my life, my lifestyle. I put it all there because when I was young like you, I really didn't have very many role models, especially female role models in academic or in medical in medical fields, and I really didn't know what life would be like being a doctor. So I pretty much put it all out there to share it with everyone, and you'll really get a lot of information if you go on my social media sites.
I was wondering if you find yourself adding a lot of your opinions into the procedures that you do, especially like facial procedures.
So one of the greatest things about plastic surgery is that it's not only technically challenging, but it's also artistic. And I think that's what really defines the plastic surgeon in terms of their talent. Before I did plastic surgery, I actually was a head, neck cancer and reconstructive surgeon. So I did a lot of thyroid cancer, oral cancers, where you're taking out a big piece of like someone's tongue and using their arm and reconstructing it. And a lot of those surgeries pretty much had the steps. If you're doing a neck dissection, it's like A, B, C, D, you follow it. Plastic surgery is unique in that there is, even though you have like the basic surgical principles, you are able to be creative and artistic. And one of the things that I always tell young plastic surgeons coming into practice is that you learn the basics in your training, but when you're in private practice, that's where you develop yourself as an artist. And a lot of the procedures that I do, even though it's like a tummy tuck or it's like a labiaplasty, so I do a lot of vaginal cosmetic surgery, or even a breast surgery, I have sort of adapted it from seeing what I like, what I don't like in other people's techniques. I spend a lot of time reading articles and seeing what's out there. I go to conferences and I'm continually educating myself and adjusting it to a way that I think is the ideal best surgery. So I feel like the surgeries that I do, I've molded and developed into my own, which is, one of the most fun things about my job.
How often do you find that your patient doesn't agree with what you've done in the end, or they don't like the outcome?
Never, because my patients look awesome. Well, part of being a doctor in any field is communication, and I think that being a female plastic surgeon, I think as women we just tend to communicate, and I'm a plastic surgery patient myself, so part of the consultation and part of planning for surgery is really that communication, understanding what that particular patient wants for themselves. So for example, even something simple like maybe a breast augmentation, part of the discussion is, what are your hobbies? What kind of look are you hoping to achieve? We go through pictures. It's very, very extensive. So once you enter the OR, both patient and surgeon are on the same page. So the preparation for the surgery is probably one of the most important things. And I see patients all the time come in my office and they say, oh, the doctor told me he was going to give me a C, and here I came out and I'm either too small or too big. The communication and the preparation are important, and I consider myself and my patients, we're part of the team, and together we create, the ideal outcome for that particular person.
How did you figure out what specialty you wanted to go into? Like, how did you narrow down out of all the ones to choose from, which one felt right?
Well, you'll find out along the path of your education. So one of the things in medical school is during the 3rd and 4th year, you'll spend, at least a month in each different specialty. And I think that is the time where you really find yourself. I mean, you go through it, because, I did internal medicine, I did neurology, I did all those different fields. And, it's always a combination of sort of like you'll just find it. It's sort of like they say, when you meet the one, you'll just know. And it is something that you really just have to feel passionate about, So for me, I'm like super OCD and technical, so I like all the tiny little nuances and details of plastic surgery. I want it to always look perfect. And I like the creative artistic part of it. So, and also, for me, the reason why I switched from something like head and neck cancer into plastics is because I'm the type of person that just gets very emotionally invested in all my patients, and after doing reconstruction or dealing with cancer and things like that, I knew that it's not something I could do without having it just be too, straining on me. And so for me, I have young, healthy patients. They want to feel better about themselves. They want to feel confident. I have a lot of moms who've gone through pregnancy and they want to sort of get their body back. So I believe that it's not just about like curing a disease, but taking care of a person as a whole, including the way they feel. And that's why I ended up picking something like plastic surgery.
What are the most important skill sets required for each of your specialties?
So I may be biased, but I feel like to be a plastic surgeon, almost in every step of the way, you really need to be sort of the best of the best. I mean, I'll be honest with you, the plastic surgery residency is extremely competitive to get into. There's very, very few spots every year in the country. And there's a lot of people trying to get those spots. Now, academic plastic surgery is very, very different from private practice, I think, as a lot of the other panels have said. But I think that it is one of the fields where there's just little to no room for error, especially in cosmetic surgery. I mean, people are young and healthy. It's not, they have a choice to see you. They have a choice to have surgery, and they demand perfection. I think in particular, when it comes to private practice, there's a whole business aspect of it, there's a whole, customer service aspect. I mean, literally, every time I open my email, because everyone's giving neurosurgeons the credit for working hard. I was in the OR probably 3 or 4 times this last week till 10 p.m. I have an early start. And I'm also a mom and a wife. So, any surgical field is going to be challenging in that respect. But, like I said, for the business aspect of it, it's ongoing. I'll be in the OR all day, and then I open my email, and there's, 10 emails from my office, 15 emails from my patients. People call in, and because I have a concierge practice, they expect, me to be the one calling them, answering their emails and their phones. So I think one of the things about medicine, when you sort of go to the real life part of it, is to see, do you like the business part of it? Do you like, that involvement? If you work, for university, you may have residents. If you work for Kaiser, your hours are 9 to 5, you know what I mean? So all of those things need to be taken into consideration, but in private practice, it's awesome you have all that free time. I feel like I'm working all the time, all day, all night, answering questions, email, working on my business, the marketing part of it too.
You said you were in school for a really long time, and I was just wondering how you handled all of that.
I'm gonna say something because yesterday I actually just did an Instagram post on this, and I got a lot of really great feedback because I'll be honest with you, it takes really, it takes forever. I mean, it takes a really long time. And there are hard times. I mean, I'm not gonna lie. For anyone who's gonna, anyone who's been successful in their life, you just need to know. I mean, it doesn't come easy. You're going to have to really work hard. But the key things are to find in yourself if you have ambition, if you have perseverance, and determination, you can get through it, because there's gonna be times where it just sucks. And I can, in my mind, I can relive all the times where it really, really sucked. I mean, there's, when I was a plastic surgery resident, I was pretty much on permacol for 2 years straight. I would go in the hospital like on a Monday, and I would leave on a Thursday, and maybe get a shower, and literally I would just get, I was on hand and face call. If you imagine in a county hospital, how many hand and face injuries come in, I mean, it's like literally you look in the hall and there's just no line. And this is after operating for, all day, like 10 hours. And what I try to tell young people, what I do a lot, like I said, on my social media, is to really encourage and inspire people during those times where it's hard. You have to just dig deep and find it within yourself to persevere. And I remember in those times where it was very painful, that I knew that, just keep your eyes on the prize. If you have a goal, you're gonna have to work for it. Everyone wants things. Everyone wants to be, a neurosurgeon. It seems like everyone wants to be a neurosurgeon, right? But not everyone can be a neurosurgeon, and those people who persevere and do the extra work and work harder, those are the ones that earn it and get to be a neurosurgeon or a plastic surgeon, So don't give up. That's my thing. You can't give up, because everyone's going to go through those hard times that are very painful. You have a long road ahead, but you can do it, and especially, I always try to encourage women, because I think as women, people are just, they're going to give you a hard time. I can't even tell you how many times, people told me women have no place in the operating room, or, you should be a news reporter, girls like you don't become doctors. You just have to have inner confidence and determination, and you can do it, It's a long road, but find it within yourself and just push harder.
So I was wondering if you went into medical school thinking you wanted to do something else and then came out doing this. Like, was it a change, or did you always know from the start this is what you wanted to do?
So since I did a residency in a different field and then switched, I think your question is very relevant. I think that, I'm going to be totally honest, I always loved plastic surgery. I think it's something that really changes the way, it's one of the fields where it makes people whole again. You know what I mean? It's like someone gets injured, you fix them. It's so cool. It's amazing. Like, someone comes in, their whole, they from a trauma, their lip is shredded, you put it back together, it looks awesome. Same thing with even cancer reconstructive surgery. For some reason, maybe just because I'm super girly and I like nice things, when I started medical school, everyone told me, oh, you're gonna be a plastic surgeon because you're so, girly and so feminine. And I think I felt a lot of pressure to go into academics. I mean, no lie, because I felt judged, and I didn't want people to think because, I was girly or feminine, that didn't mean that I was smart and academic. So I initially picked a field that was very, very academic. I mean, head and neck cancer surgery, super, super serious, very, very intense surgeries, and I did a ton of research. I published 40 plus, papers or research articles, because I felt that pressure. And I think that, there just came a certain point where I was just like, you know what, I'm gonna do what I love. I loved the technical aspect of doing head and neck surgery, but it wasn't really, really my passion. It's something where I learned a lot, and I think it made me really a technically excellent surgeon. But I just, in the end, I just said, you know what, I'm gonna do what I really, really love. And I went through a whole extremely painful 2-year residency in plastic surgery, where I was on call every day. And ended up doing something that's amazing. And so I wake up every day super excited and